I'm Dr. Nick Neneman with Neneman Chiropractic Clinic, and welcome to our fourth video blog. We actually missed last week, got a little busy, didn't get one recorded, but we're back this week and we're going to continue to try to do this every single week. What we want to talk about this week is a very popular topic. We're going to talk about headaches. This is one of the most common things patients suffer with. Most people when they get a headache, they go to the medicine cabinet or looking for aspirin, ibuprofen, Tylenol, and what a lot of people don't realize is most headache situations can be helped with chiropractic care. Chiropractic adjustments, specifically to the neck, can help tremendously with headaches. Not with all people, but with with a majority of people. And there's all different types of headaches. There's migraine headaches, tension headaches, sinus headaches, cervicogenic headaches. There's all kinds of headaches out there, but really, I like to lump, headaches into three main categories: cervicogenic headaches, common migraine headaches, and classic migraine headaches. Those, I feel that a majority of all headaches can be lumped into that, because even if you're talking about a sinus headache or a tension headache, that's usually can actually be classified as a cervicogenic headache. And the term cervicogenic means stemming from the neck. There are a lot of neck, fixation and tension issues are what are actually causing headaches. It's actually causing that tension or sinus pressure. And the other thing I want to mention too is with migraine headaches, it's really, I feel, again, overdiagnosed or misdiagnosed. I have people all the time come and say, I get migraine headaches, and then I start asking them questions. Well, what they're experiencing really isn't a migraine headache. A lot of people just call a bad headache a migraine, but a migraine headache has a specific set of symptoms, and I'll go over that here with you. And more specifically, let's talk about the two different types of migraine headaches. There's the common migraine headache and the classic migraine headache. The classic migraine headache has what is called an aura, and if you don't know what an aura is, it's a sensation or a feeling the patient gets, basically forewarning them that the headache's coming. Usually it's in the form of a visual disturbance or a smell. A lot of times people with true classic migraines talk about they get this certain smell, and then shortly thereafter they're getting a horrible migraine headache, or they see like kind of flashing lights. And then boom, they have a migraine headache. So, that's what a classic migraine is. It has an aura, but then, you're going to usually have sensitivity to light. You could have nausea, vomiting. Those are all symptoms of really any migraine. But again, the thing that differentiates the classic migraine is the aura. A common migraine is all the symptoms I just said except for the aura. There's no aura with a common migraine headache. So there's plenty of people that are getting common migraines that don't have an aura. It's not a classic migraine. So again, that would be just nausea, vomiting, sensitivity to light. And these migraine headaches, they can last anywhere from 4 hours to 2 or 3 days. That's pretty typical with that. Now, on to cervicogenic headaches, which I feel is the most common headache out there. Those. Not saying you couldn't have a little bit of nauseousness or sensitivity to light with a bad cervicogenic headache, but typically you're not going to have those real severe symptoms. You're just going to have a lot of pain and pressure. Like I said, you won't necessarily have nausea or sensitivity to light. You're certainly not going to have an aura. That's because that's with migraines. But yeah, cervicogenic headache, it is neck related. Most people have horrible posture. The most common posture is what's called anterior head carriage. It's when you look from the side. It's when a person's head basically sits forward of their shoulder. That's something you can actually look at when you look at people from the side. Is their head up above their shoulder, or is it way out in front of their shoulder? That's called anterior head carriage. It creates abnormal biomechanics in the neck. It creates joint fixation, nerve pressure, blood vessel pressure. It constricts everything. It creates all that tension, so you're not having proper blood flow. You're not having proper nerve flow up into the head, into the brain, and that's when you can really get those cervicogenic headaches. And that's where chiropractic comes into play. Chiropractic helps with cervicogenic headaches and migraine headaches, both. As a chiropractor, I evaluate their posture. Do they have anterior head carriage? Whether they do or not, then I go in each specific vertebral level and you look for that joint fixation, that nerve interference, you know, pressure on the blood vessels. You know, that's what a chiropractor is going to evaluate. And by adjusting those areas that are fixated or where there's nerve interference, you're going to free up that area so the joint moves normal. You alleviate pressure off the nerve. You alleviate pressure off the blood vessel. It allows normal flow to the brain, and that headache can go away. You know, and I'm not saying if you have a headache and you come in one time and you get adjusted, you're not, you know, you may have the headache immediately go away, but it's not necessarily going to take care of your problems. You know, a lot of times when a patient has an issue with regular headaches, you know, they come in for a treatment plan, and with, you know, a whole series of adjustments, then they start noticing, like, hey, I'm not really having headaches anymore, or hey, I only have one a month, or, you know, so you know, chiropractic, it can help tremendously. Again, whether it's cervicogenic or migraine. You know, even with migraine headaches, when you adjust an area that's fixated where there's nerve interference and you adjust that neck, it's gonna, you know, make the joint, the vertebral joint, move properly. You're gonna get that normal nerve flow, blood flow to the brain, and you're gonna get that same effect with the migraine headache. So again, if you are having a headache, you should come in here to Neneman Chiropractic, get checked out. We'll evaluate, you know, your neck and your whole spine for that matter. And, you know, I'll make a recommendation on what I think you need for treatment, and with adjustments, you know, hopefully you can get results. So hope that made a lot of sense, and, you know, hopefully you learned something about headaches. Again, there are other types of headaches, but I feel like those are the primary ones you're normally going to see. And like I said, tension headaches, sinus headaches, they can almost be lumped into cervicogenic headaches. So you know, and as far as migraines go, one other thing I want to mention is you know, there's a lot of causes of migraines. It's not just neck issues. You know, there's with some people it's hormonal. You know, specifically with women, you'll see hormonal issues that'll trigger the migraine. With some people, it's foods, like certain foods they eat trigger a migraine. So there's a lot of different causes, and a lot of times it's really hard to pinpoint. So if you come in here with a migraine, there's a chance it may not be neck related. You know, so it's not, you know, a cure-all or a fix-all, but we're certainly going to check out your neck, see if that could be a culprit. You know, and the only way to find out is to come and get checked out. So again, thanks for listening this week. Join us again next week. We'll be back with another video blog, and have a great week.